Denise Bruckerhoff, and I have an internal medicine practice called Bruckerhop Internal Medicine Associates here in Mansfield, Texas. Come see me. So you can come see me, and I can be kind of your home base for your medical care, just like you would a family practice doctor. However, we do receive referrals from specialists when they're managing patients that maybe they've lost their primary care doctor or they're seeking a new primary care doctor for whatever reason. So, for example, we do receive a lot of referrals from the pain management doctors where their patients may need like diabetic care or high blood pressure care, so that they can have good results at the pain management provider's office. Or we receive a lot of referrals from OBGYN, especially in young women that have been having babies and getting most of their routine care from their gynecologist. And maybe they're at the point where they're not having babies anymore, or they're needing other care besides gynecology care. Say, for example, if they're diagnosed with thyroid disease during pregnancy and the gynecologist may not want to continue managing that piece of their health. So they'll refer them to us to manage their thyroid disease while they continue to manage their gynecological needs. So our bread and butter is really going to be high blood pressure, diabetes, COPD, emphysema, thyroid disease. Obesity is a big one. We manage a lot of weight issues, weight-related issues, cellulitis, edema, congestive heart failure, atrial fibrillation, heart disease, vascular disease, dementia. It's really a very wide array. So we basically manage a patient's medical care unless they are in need of a specialist for some reason. So we'll kind of be the quarterback of your medical care. And then if we feel like you would benefit from seeing a specialist for a disease process, we would refer you out to that specialist. And then we would still follow up and try to tie the pieces together for you. Oh, well, lots of change. The biggest change that we've had recently, I would say, would be the adjustment with telemedicine throughout COVID, that we're able to provide telemedicine visits to patients as well as in-person visits. And a lot of our patients really do prefer the telemedicine for certain types of visits, especially things like post-operative follow-ups, whenever we're trying to just make sure they're on the right medications, making sure they're not having any of the most common causes that would lead them back to the emergency room that may be totally unrelated to their actual surgery or recovery process from the surgical standpoint. Also, the other biggest change I would say is the kind of evolution of technology over the last 3 years in remote monitoring, remote patient monitoring. And so we provide some services to facilitate remote patient monitoring, and we're just seeing a lot more remote monitoring opportunities. For example, home sleep tests, home blood pressure monitoring, home glucose monitoring, where we can actually see your numbers right in the office. They're monitored 7 days a week by an RN. And then if we see changes in your trends, the RN notifies me directly, and we have a one-on-one conversation about that. And then we get back in touch with you to find out what's going on. So, for example, it might be something so simple as you lost your medication, or you ran out of your medicine and you couldn't get to the pharmacy to pick it up, or the pharmacy wouldn't fill it, or you're waiting on a prior authorization, or it could be that you've been eating out more because your kitchen's under renovation. It could be a lot of different things. And so we work through that process with you, as well as providing additional counseling regarding your medical conditions. So we do focus a lot on prevention, and I actually am very passionate about prevention. I would rather try to catch things before it becomes a major life-changing event for you, so that we can. So the number one thing I would say would be diet. Our American diet, typically, there's almost not a single patient that I see that we can't talk about or counsel regarding diet. And so the old saying of "you are what you eat" is truly so important when it comes to heart disease, when it comes to vascular disease, diabetes, thyroid disease. Our entire metabolism controls so many other factors that we treat. And so one of the ways that we try to stay on top of this for patients is we do an annual physical once a year. And then I would say one of the most important things that you can do is plug into your doctor. Okay, so when we recommend follow-up appointments, it's important that you follow up with us so that you're not having to follow up in the emergency room. So we're watching on your behalf for your medical issues and the things that we're seeing, following up on those to make sure that your labs are getting done, your imaging is getting done, that we're repeating tests when they need to be repeated, that we're staying on top of any side effects of medications, and that we're really watching for things that might become more of a problem in the future for you. So we do refer out to counselors if needed. We also have our chronic care management program where the nurses will check in with you once a month and talk with you about your medical conditions as well as your diet, to tie both your diet and your medical conditions together for you. Because for some patients, especially if you have kidney issues, diabetes, high blood pressure, it can be very confusing, especially if you're seeing a lot of specialists, when one specialist is telling you not to eat one thing and another specialist is telling you not to eat another thing. And so before you know it, you go home and you feel like you can't eat anything. And so we have to try to kind of tie those diets together for you and just kind of give you some recommendations as far as how you can manage that. The other thing that we do is we review your data. So for example, if you had high blood pressure, we would review your blood pressure readings each time that you come in, talk about any changes that you're noticing, talk about trends that we're seeing, and what's occurring in your life at the time that these trends are happening. So for example, if every Wednesday night you have date night with your spouse or something, and then you go out to eat and then you go to a movie, and then Thursday and Friday your numbers are always going up, we talk about healthier alternatives for where you can eat or what you can choose or how you can cut back on that processed food and salt to try to help your blood pressure to stay at a good range for you. Foods can be bad for you when not eaten in moderation. If I had to choose one, I would probably choose soda. And the reason I say that is because it's filled with caffeine and sugar and salt. And what used to be something that's more of a treat in our lives has now become something that's served with every meal at most restaurants. And so oftentimes there's not even another choice besides soda at a lot of places that you'll eat at. And so if I always tell my patients, if you wouldn't recommend it for your child, for example, if you wouldn't recommend a 32-ounce soda for breakfast for your child, it's probably not the best for you as an adult. And so we also look at water intake, and we compare like water intake to your caffeine intake to your soda intake. And we talk about what the appropriate amount of water for you as an adult would be. And so sometimes that can really be enlightening for patients to realize how much water they're actually taking in. The biggest battle that I think we have ahead of us is the obesity and diabetes epidemic. I think that that is going to be the biggest challenge. There's new clinical studies that have come out that is estimating that the rate of diabetes is going to increase in the next 40 years by like over 600%. So we've got to change the way we think about food, and we've got to change the mindset of scarcity, because in reality, those fries are going to be there next week, right? We're still going to go out to eat the following week. We're still going to be able to have, that frozen dinner the following week. So we have to start paying attention to our portion sizes, and we have to start paying attention to the quantity of processed food that we're consuming, because if not, we're going to be spending a fortune on prescriptions. So in internal medicine, if you ever come to see me, I like to ask a lot of questions. And part of the reason for that is I really like to find out the root cause of why something is happening, because I want to treat the cause of why something is happening, not just the side effect. I don't want to give you a medication for a side effect of another drug when we could just fix the cause of it, right? So we can't always do that, but a lot of times we can determine, why is your blood pressure going up? Because you're anxious, because you're panicked, because you're stressed out, you're eating too much processed food, you're not exercising anymore, you're gaining weight. And so when we talk about that, we can't change the genetic factors that affect your blood pressure, but we can change all those other factors to help improve it. And so I describe this as like peeling back the layers of an onion. Any factor that's affecting your thyroid, or affecting your blood pressure, affecting your diabetes, affecting your circulation, affecting your depression, we want to try to treat each one of those so that we can help you to feel better. So for example, mental health is a huge problem in our country, and we just do not have enough resources for that. And so I always try to encourage patients, if they're seeking out medications, to also consider counseling, because however, most people don't want to spend their extra time at counseling, but it's actually going to help you in the long run not to rely on medications quite as heavily as you would otherwise. And medications aren't a standalone answer. We have to have the whole person approach to this. And so, for example, if you're not sleeping well and you're depressed and you're suicidal and everything is just kind of tumbleweeding, we need to address all of those issues. We don't need to just give you a pill. Well, and a lot of times also when we talk about mental health and just how people are feeling, like sometimes I'll just stop and I'll say, well, how do you feel right now? Because when we're eating so much processed food, you'll start to know that you feel sluggish and you'll have brain fog and you can't think clearly and you're not sleeping well. And when we clean up our diet, a lot of times that's the first step in feeling better. So one of the ways in which that we can improve your diet is turning that script around that I can't do this and this is too hard and I'm too busy and I don't have enough time, but instead starting to show you that you can do it. And so we have to try to help coach you through that, to teach you that you can do this and that even the smallest changes in your daily life will actually have big impact on your health. And when I'm talking about your health, I'm not talking about today, tomorrow, next week, how much you're going to weigh in a month. I'm talking about 10 years from now, 15 years from now, and how you're going to age moving forward. Well, and I don't have much experience from a medical standpoint in treating the youth because I only treat 18 and up. However, you can't just turn a blind eye to it because what I see is entire families eating this way. And so when we talk about your cholesterol, we'll talk about how many times do you go out to eat? How many times do you eat fast food? How many times are you throwing that breaded chicken nugget in the air fryer and calling it a day? How many servings of vegetables is your family eating a day? And none of that is ever meant to be pointed or derogatory, but we have to try to get an idea of what each person is doing, what each patient is doing, because I can't treat everyone the same for cholesterol or diabetes or obesity because everyone has a different diet, as far as what they're eating. But in general, it's a lot more processed food than what we need. So we do offer some additional services in our clinic. We try to bring some new services in periodically that may appeal to our patients to help just kind of keep their services at home. What we've found is, especially with some of our patients, they don't want to go out to different offices for different services. And so right now we do have On Point Allergy is providing allergy testing and treatment services in our office. We are anticipating opening a med spa later this summer. And we also have what I mentioned before, the chronic care management program that we do. And we also partner with a company for with home sleep studies that we can get pretty good sleep studies off of those. And the benefit of the home sleep study, which I was always more passionate about the clinical sleep study until COVID came along, but people just don't want to sleep anywhere but at home. And a lot of times I would get the excuse that they just didn't sleep good in the clinic. This isn't their home environment. So we take that variable away. You go to sleep at home, and instead of sleeping for one night with the sleep equipment, you sleep for 2 or 3 nights. And so we get a series of hours that we can analyze for your sleep study that way. And I would say one of the biggest misconceptions about sleep apnea is that you have to be overweight for it. And that's absolutely not true. We have patients that are of all different sizes that are diagnosed with sleep apnea. And if we can get you sleeping better, we can get you feeling better, and we can get you moving more. So there are certain things that most internists will kind of draw the line, like this is where I stop, this is where the specialist picks up. And so for each internist, that boundary might be a little bit different. Okay. And so some internists will have, special interest in certain areas. So they might take it a step further than another internist would, right? And so it's hard to say what an internist will and won't cover because everyone is a little bit specialized in that regard. So we do manage basically all of your care from the age of 18 to end of life. And then we refer out at which point we feel like you need a specialist, but we get the notes back, we review what's been done, we follow up with you on that. And so it's really like they're just adding another partner to your medical team for that. So internal medicine is a specialty of primary care. So primary care is considered family practice and internal medicine. So oftentimes the training is different. And I don't want to speak too in depth because each training program can be different to some regard. Where I trained at, the family practice had more of a clinical approach in their residency training, whereas internal medicine had more of a hospital approach to it. So we spent a lot more time in the hospital setting and family practice spent a lot more time in the clinical setting. Now, in different areas, that's different because years back, family practice would still do a lot of hospital and they would still deliver babies even. Well, most of your family practice don't still deliver babies, right? Family practice and internal medicine do provide the screening gynecological exams that a gynecologist would, but we don't provide the interventional treatments for those exams. So say, for example, if you have an abnormal pap smear, I'm not the person you want to see for that. You want to see the gynecologist that's going to do the procedure to fix the abnormal pap smear. Does that make sense?
Yes.
So in different areas, and it depends on where you trained and kind of how you pursued your career after residency, as far as how much hospital training you have versus clinic training. And I think in my perspective, the hospital training has been very beneficial because I've seen the worst of the worst. And then the flip side of it is I can try to prevent you from having the worst of the worst. So I've spent a lot of nights in the hospital watching codes, managing codes, where people stop breathing and people, their hearts stop and they have, life altering experiences that are happening. And so I've seen patients that are in comas for days on end. And I've seen patients that have really bad car accidents and what that recovery looks like and the neurologic injuries that people have sustained. And so it really, your practice once you get out into medicine as a primary care doctor, whether it's internal medicine or family practice, it depends a lot on what your experience was throughout your training and what you were exposed to and what you saw.